Hello, and welcome to Beyond the Surface. The Healthcare Services Institute was founded 9 years ago to examine a frequently overlooked foundational factor in the spread of HAIs. Over these years, we've gained valuable insight and effectively highlighted how surfaces and products can support and harbor microbes, along with the challenges healthcare professionals have encountered when attempting to clean and disinfect them. I'm Linda Liebert, the Executive Director of Healthcare Services Institute. On our podcasts, we will interview healthcare experts, patients, thought leaders, researchers, and many others about the challenges we face in our ongoing battle to mitigate the spread of microbes that cause HAIs and solutions that are being introduced. I am so excited. I actually am going to interview a colleague that I get to work with every single day, Dr. Gavin Macgregor-Skinner. Welcome.
Hi, Linda. How are you today?
I am really great. So what I'd like to do is ask you to please introduce yourself, because I could go on for hours.
Well, as Linda said, we do get to work together every day, and that's pretty awesome. So I'm Dr. Gavin Macgregor-Skinner. I'm a senior director at ISSA, the cleaning industry. And what I do, I'm a trained epidemiologist through the US Center for Disease Control, the CDC. So a little bit like a disease detective. And working with Linda, we try to help buildings, the built environment, anything, anywhere that needs to be cleaned, do it in a way that is valuable, gives a return on investment, but creates a healthy and safe built space or indoor environment. And that's the key to the work we do. We want to ensure that everyone who cleans does it in a way that's focused on health and safety.
One of the things that we want to talk about to begin with is the gap between regulatory testing and compliance and what is really happening in the real world. Because we both know that getting clearance from EPA or FDA requires specific things. But when you get into the real world, we're not dealing with a laboratory or specific testing. We're dealing with fast-moving equipment. We're dealing with disinfectants that may be causing damage, etc. So let's talk a little bit. You and I had a conversation yesterday about a call that a colleague and I had with a company that is a medical device manufacturer who was very focused on having to meet the FDA testing requirements. But when it came to us explaining what our partners in healthcare, the healthcare professionals are dealing with equipment that's breaking, IFUs that they can't read and understand, patients that oftentimes are put at risk unknowingly, they really didn't want to talk about any of that. They just wanted to be sure we were clear that they had met all of the FDA requirements to be able to put their product into service. Tell me some of your experiences with regulatory and real world.
That's a really good question, Linda, and I think it's why I'm still with the industry. I know that when I came over to the cleaning industry with ISSA, gosh, in May of 2020, I thought I'd be here for about 12 months. Yeah, we had a bit of a COVID problem. We were trying to work out how to clean for a new, virus that was taking, globally moving around the world. And I thought, yeah, 12 months with this organization will be fantastic, and I'll be able to help a bit, and then I'll go back and do the stuff that I did before. But I stayed. And I stayed for that important point that you just mentioned. The gap across the whole value chain of the cleaning industry, the gap from research and development, the R&D, lots of millions of dollars going to that. The gap between the chief scientist and the research officers at manufacturers, and then the gap within those companies with their marketing people. Yeah. And this is why we did research and development, but now we're saying something for marketing, which again, getting ready for the next flu and cold season, base it on science, as you and I often talk about. And then going out to look at the value chain from manufacturing to distributor and reselling products. And do we package a bundle for infection prevention? Do we package a bundle of cleaning products, tools, equipment, products, the cleaning chemicals themselves with the processes, and the practices that we need to clean for health and safety. And I sat there and I went, no, we don't. Or
Yeah.
some people do. And if some people do, how do we at ISSA become a force multiplier, which is what a trade association really is? We're all about force multiplication, where we take a best practice or something that is based on science and evidence and works, and we multiply that to millions of other people, or again, thousands of other organizations and facilities to get that implemented. And so this is where I found it so fascinating to come here and say, right, there are rules, there are
Hmm.
requirements, both federal and state, and that's important. That's all focuses on health and safety. And as you correctly said, the IFU, the instructions for use. And then in the real world, and they call that real world what we do implementation science. So our implementation science, the conversations that you and I have, Linda, often is how do we take all that wonderful science and evidence in the clean industry and use our implementation science framework to make it happen in the real world. But what we find is there's so much variation in cleaning and disinfection in the real world. And we don't want to be a top-down organization which says you must do this. We want to be more bottom-up and empower and encourage people to do cleaning and disinfection based on science and evidence, but in a way that they can measure that.
Right. Exactly. Exactly. And we do that through a lot of our training programs. One of the things that I enjoy the most is meeting with end users, looking at their current situation, and then coming up with solutions that work for them based on their individual needs. And you not too long ago sort of did something similar in Fiji. Tell
Yeah,
us more about that.
yeah. So what we found, the way that ISSA got engaged in Fiji, again, was through our members, the value of our members. But it was because there was a news article published that went global about their hospital-acquired infection rates in 3 hospitals. There's more hospitals in Fiji, but this data was real, and we again we compliment the Fijian government, the Minister of Health, and the hospital directors for their transparency and their honesty to share that data. But they were having a real hard time with hospital-acquired infections. So what we mean by that is infections in patients that they didn't have when they were admitted to the hospital. That's a
Mhm.
hospital acquired. So they very honestly said we are having some problems. So worked with RJ Patel, Gosha Baran, members of ISSA through our ISSA residential group, and we actually travelled to Fiji with a very open mind. We initially, sat there and said, "Oh, we'll go and tell them this, tell them that." No, we won't. We'll go over and we'll just listen. And we went and listened and watched. That was our first trip. Show me how you clean the bed mattress. Show me how you clean the operating room after an operation. Show me how you clean the waiting room or where you're doing your triage. Show me how you clean the pediatric ward. And we went through step by step, so they could demonstrate without a lot of engagement on just visualizing how do you do it. Just show us how you do it. Then we took some tools over there to Fiji, our ATP meters,
Yeah.
um, UV light, and we started making the invisible be visible in the hospital. And we started showing that through, adults learn by doing, and by making the invisible visible, then we could say, well, it's no one's fault, but there is a problem here.
Mhm.
So our very first trip, Linda, defined that problem. So ATP is the energy of life. And if you detect ATP on a surface, that means there's something living there. And then as experts that you and I are, we then interpret that something living as being most likely bacteria. And we were finding really high numbers on bed rails. We were finding really high numbers at the nursing station where all the nurses gathered. We find high numbers on a lot of surfaces that were touched often. So they weren't being cleaned. The frequency wasn't high enough, or the way that the process of cleaning wasn't being done. So we got that data, came back, and we developed a program based on cleaning for health and safety in the hospital to go out there and let them clean the way they were doing, measure it, get a number, and then try to come up with processes that would improve that. And what we actually came up with was that there was just a lack of microfiber.
Yeah.
So this is our ISSA cleaning for, I'll hold up properly, cleaning for a reason. You know, we clean for a reason for cancer patients. This is our pink microfiber for cleaning for a reason for cancer patients. And we found that they were not using the right tools and equipment.
Yep.
And simply by replacing the mops, the cleaning cloths with high quality microfiber, we were getting significant reductions in our ATP meters.
Yeah.
And then we translated that to, what does that mean? Well, it means you're removing living things. What are those living things? Bacteria. And over time, this was about a 6-month period, we saw the numbers of the hospital-acquired infections decrease. And we said to them, how do you feel about that? And they went, we think this is working.
Yeah.
So we had to be patient. It took some time. It wasn't us being top down and saying, you must do this, you're in trouble, you didn't do that. It was actually using that philosophical adult education paradigm of adults learn by doing. And if you engage adults in training courses where they actually do stuff and they go, oh, is there a better way? Is there a better practice, better process? Yes, there is. Can I measure it? Yes, there is. And we now have seen the next part of that project is consistency.
Mhm.
And so what we're now seeing is that when they send us in their results, their UV lights, their ATP meters, they're doing some swabs as well and sending them off to the lab to be cultured. They're finding that they're doing much better with their cleaning and disinfection protocols than they've done for many, many years. And more importantly, we're finding the number of hospital-acquired infections has decreased significantly.
Right. Right. So that was a huge success story, definitely. And one of the reasons why ISSA in our healthcare training programs, we begin with an assessment. We go and sit down and we talk and we observe. And that's really where we start. So let's move into a little bit more about one of the things that is frustrating to healthcare professionals is the fact that they will get a new product and then all of a sudden now they're faced with cleaning it. And one of the, let's just talk about medical devices because they do typically have to go through FDA testing and evaluation. We all know the stories behind the endoscopes and how, yes, they went through testing, but now we're in real world with real people that are cleaning the product and it's not working. Yesterday on our call, the teams now granted, in defense of the manufacturers, the people that innovate and design products are not the same people that write safety guidelines or instructions for use. So there's a gap there as well that we've recognized. But what's more important is that the manufacturers have don't always have a very clear understanding of how their products are used in healthcare and how they're cleaned in healthcare. In fact, when we talked with them, we were explaining that, it's not just med techs that are cleaning, it's nurses, it's CNAs. It could be a family member that's just wiping, for instance, the front of an IV pump off. And so there is a definite gap between FDA compliance and real world, now we're going to clean and disinfect. In the US, there is now regulatory requirements for people to follow the IFU or instructions for use, or they face fines and penalties. And there's a lot of confusion and frustration around that due to a lack of knowledge and understanding with when an EVS or a med tech or a professional walks into, for instance, a trauma room right after a trauma, they're given 20 minutes to turn the room over. And you can have up to 40 or 50 instructions for use because every surface, every device has a different IFU. And that was a confusing discussion with them yesterday because there is a total lack of knowledge and understanding until they're confronted with a recall due to high infections or chemical incompatibility with the surface materials. What have you run into, and what are your thoughts about this?
Yeah, I think this is really interesting, Linda, in that it reflects my previous work experience when I was doing a lot of work on, on biological weapons and also diseases we call them diseases of high consequence. So, for example, Ebola is a really good example. But again, so it's important that when we were visiting the actual sites for many years, looking at biological weapons and high consequence diseases like Ebola, what was out there in the real world was a culture of fear.
Mhm.
We're coming from the US to inspect your facility because we must be in trouble. And that wasn't what we were there to do. We were there to empower people and give them the ability and the acknowledgement that what they're doing is creating a safer built environment. And so, even here in hospitals now, and I know you and I have talked about this a lot, we both go into hospitals. And if I turn up and I tell them who I am, they're going, "What did we do wrong? Am I in
Yeah,
trouble?" I went, no,
yeah,
that's not how to, no, let's have a cup of coffee. Let's start that conversation again, because that's not what I'm here to talk about. It's not
yeah,
you're in trouble. I wanted to know what your practices and processes were. I want to know what tools and equipment and cleaning products you're using. And I want to know if I can help you do it better and hopefully get a better return on investment, make the invisible visible, get some metrics, some key performance indicators going. But every time I go to a facility, the same question is raised. What did we do wrong? Why are you here?
yeah.
And you and I both work in that environment, that culture of fear. And I know you and I are trying to change this into a culture of safety and recognition and acknowledgement. And that's what's really challenging. So if you go back to the COVID-19 outbreak back in 2020, we contacted, gosh, at ISSA, we contacted Apple, we contacted Samsung, and we were trying to learn what's the risk of infectious diseases, germs spreading from your cell phone, because we thought they would know. And they said, "Oh yeah, we've got some cleaning guidelines." And it was like 6 clicks of the mouse on these websites to find it, and then it just said, "Do this." And I went, that doesn't get me excited. So you've translated that now, that example there where we talked about the spread of those objects we touch often, like cell phones, when it comes to even just flu season, which is coming up pretty soon, to proper, appropriate equipment in a hospital and understanding whether the manufacturer who spent all that money developing this wonderful piece of equipment that does whatever it does has to do to save lives, is it being used properly? But more importantly, is it is it the way that they're maintaining it and cleaning it, breaking that cycle for infection prevention? And unfortunately for you and I, that's very subjective.
Yeah.
It looks clean, yeah, but ask the next person. They might say it looks dirty or I don't know. And so we've got to go back and get more, be able to measure this better. And there are the tools and the techniques to measure it. We use ATP swabs. I use, hospitals get really surprised when I say, look, at my cost, in my budget, I'm going to take 5 samples for you and send it off to the lab and see what grows. And they go, don't do that. I went, yeah, no, we have to, so that when we come back, we can then correct the process, the practice, the procedure. We can actually work on this to make sure we got consistency. So really interesting when we look at hospital equipment and the role that hospital equipment can play in spreading germs,
Mhm.
spreading contamination, creating hospital-acquired infections. It's high, and we don't need any more research. We have so much research that you and I know about that we can sit on that. But that next part of that, getting beyond that subjectivity.
Yeah.
And then the other challenge you and I have is frequency.
Yeah.
How often should we clean it? And that's because that takes time, people, resources, money, and that's a big barrier for us. Is it once a day? Is it twice a day? Is it once a week?
Yeah. Exactly. You and I talked the other day about mattresses and the fact that it is number one, the closest surface to the patient from the time they enter the facility until the time they leave. So it's the highest touch. It is the one that you often have to clean multiple times in a day. And so when we go back to a little bit about the FDA compliance, the testing that the FDA requires is proof that you can clean it log reduction wise. It does not, there's no requirements, by the way. There are no regulatory requirements that you validate that you can actually clean and disinfect anything in a healthcare facility as if you're in the healthcare facility and cleaning it 15 times in a day. So there's a lot of information we don't have from that regulatory side that they are suddenly confronted with in a healthcare setting. And the educational somehow getting that clarity to the manufacturers who, and I don't mean this to be picking on manufacturers by any means. What we want to do is create a bridge of communication and support so that manufacturers know that when they're designing something or they're creating an IFU, that it needs to fit into an overall plan for the healthcare facility so they can actually follow it and it's actually meeting the needs that they're confronted with. So quickly, let's talk about mattresses just because that was a fun conversation. There's a lot of research about mattresses. And tell me a little bit about the experience that you've been dealing with recently.
I think the idea that the mattress that we have in our home for our personal use can be the same material and mattress that you can use in a hospital, a hotel, a university dormitory, a long-term care facility, and where you may not have the same person sleeping in that bed, say in a hotel or a hospital, things will happen. I think you shared a great story where you'd seen a mattress that was cut in half, and you know the discoloration throughout that mattress. Well, we often say in the cleaning industry, moisture is our enemy. So we all sweat at night, and we all shed skin cells and other things, and so those mattresses do get contaminated. Um, and over time, that contamination increases. But there's the way to, if we went out to every hotel in the country, if we went out to every hospital in the country right now, um, every university dormitory and said, how do you clean your mattress? How many answers would you and I get? And it's a lot. It's a lot of variation, which is wrong. And then we've got to go back to the manufacturer and say, look, how do we make a mattress for these facilities where infection prevention and control is so critical and important? And I was in a long-term care facility. I was in a senior facility a few weeks ago, and they were telling me the problem was that they had good mattresses with good covers on them that were part of their infection prevention program. And I looked at those mattresses and said, yep, that looks good. You can clean and disinfect that mattress. That's going to decrease the risk of germs spreading and causing infection. And then I said, what's that mattress over there for that person? Because it looked different. Oh, the family snuck that mattress in to the nursing home and replaced our really good mattress for infection prevention with their mattress because their loved one wanted a better mattress. And I sat in the facility and I looked at it and went, here's the door, here's the reception, here's the hallway, the corridor, how does a family sneak a mattress how does that happen? And I couldn't work it out.
Yeah.
And then they were telling me about the challenges they have because once the family snuck the mattress in, it's really hard to get the mattress out
Yeah.
because the family's going, oh, no, 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 no. Our loved one needs this mattress because of these reasons. And we provided that. We're paying for our loved one to be in this care facility. We wanted, but it just broke down all those wonderful, processes that we had to prevent infection. And you've got this mattress now that's really you can't clean.
Right.
And how many times do we go into hotels? You and I travel a lot. And the first thing I do is take out my black light and look at the mattress and look at the carpet and then try to get a room upgrade based on glows in the dark. So in 2025, there's still a real challenge for us as as disease detectives, as infection prevention experts, to come up with a practice, a protocol that decreases the likelihood or the risk of germs accumulating on a mattress. And I don't think there's a clear answer there. And so what we've seen in some of the hospitals we're working, they've got good covers on them. We know those covers keep out the moisture, keeps out the skin cells, keeps out the germs, and they're able to be clean and disinfected. But then it gets back to the frequency. How often do you do that? And when do you have the time to do that?
Yep. And when does that cover break down to the point where it is not moisture proof anymore? Now you've used a disinfectant on it enough where it has become a sponge. And when do you change the mattress? When can it no longer work? And you talked a little bit, we talked about the inspections that happen now because beds are a class 2 medical device now. So there are required inspections on beds on a regular basis. And tell me how many in that facility did not pass inspection?
Yeah, this is really important, Linda, that the inspections aren't pass or fail. The inspections are part of our continuous improvement protocols and the way that we want to create more of a culture of health and safety, more than a culture of fear. So when I went to that facility and a lot of the mattresses did not pass,
Yep.
we were trying to get beyond the oh that just happens. No, it happened, and now we have to fix it.
Right.
And we have to sit down as a team to come up with a protocol that fixes this and then fixes it in a way that's consistent to prevent it from failing next time we come and visit. And it's a
Correct.
little bit like, people knew that I was coming on a Wednesday, and then I overheard during a coffee break, gosh, we worked so hard on Tuesday, Gavin, because we knew you were coming on the Wednesday. You weren't supposed to do that. You,
Yeah.
we were supposed to come in and see the real world and see the facility as it was, and not have you work 16 hours on a Tuesday in preparation for my visit to do an assessment on a Wednesday,
Yeah.
because that's the culture of fear we
Yep.
want to avoid. And so we've got to flip that whole paradigm and say, how do we create that culture of safety? But more importantly, so many of these mattresses were failing.
Yeah.
And then we said, what's the next step? And that's what everyone was stuck on.
Yeah. Yep. Exactly. Well, Gavin, you and I could talk for hours. We usually get to in our real work life. So it has been such a pleasure to have you on the show today. I'm looking forward to, we've got another interview that we're going to do here for one of our next shows. And that is, you unfortunately became a patient more recently, as did another colleague of ours. And being a patient is a different experience for a healthcare expert. And so I look forward to talking with you on our next show about that. And with that, we will see you again soon.
Thanks, Linda.
Thank you for listening to Beyond the Surface. This podcast is brought to you by ISSA, the Worldwide Cleaning and Facility Solutions Association. Please subscribe and write a review for us on whatever platform you enjoyed this podcast on. For more information, go to healthcaresurfacesinstitute.org.